The motion be agreed to, and I give the call to the member for Mallee.
Thank you, Deputy Speaker. I rise to support the motion by the honourable member for Forrest. In particular, I call attention to the University of Technology Sydney Ageing Research Collaborative report, which strikes home at issues raised with me by leadership at many aged care facilities in Mallee. These issues largely centre around care minute requirements and the lack of registered nurses to meet expedited requirements legislated by the Labor government. The report states that meeting the incoming mandated standards will require an additional 6,922 full-time registered nurses in Australia by the 1st of July. Meanwhile, at Senate estimates, the Department of Health said that an additional 10,000 to 14,000 nurses will be required to fulfil the care requirements due to come into effect by October this year. Less than 5% of aged care homes currently have the required direct care workforce needed to fulfil the requirements that will be placed on them. It's astounding. 95% of homes will need to find more staff, and as we know, the workforce is already thin. It is an impossible situation. These figures highlight a serious issue that is only going to get worse over time. Mallee aged care residential facilities have certainly made it loud and clear to me. Facilities such as Dimboola's Allambie Elderly People's Home, which has sadly had to close recently for this reason, or Minyip's Dunmunkle Lodge, and Donald's Johnson Goodwin Memorial Home, who have both communicated the issues that they are having, and facilities such as Maryborough's Havilah Hostel, another community institution of over 160 beds that is also facing troubled waters. 2 out of 3 residential facilities around Australia are unviable. And the closer we get to the deadlines this Labor government has determined, the more pressure will be applied. I have been working closely with Mallee aged care facilities and their communities, listening to their concerns and writing to the ministers concerned with little to no understanding reporting. In Dimboola, before the closure of Allambie, I faced an impromptu community meeting and delivered their petition to the Prime Minister from the many concerned residents of that town. I met with the Chief Executive of Dunmunkle Lodge, Peter Ballard, and board member Andrew Clark and talked through their situation recently, listening to their proposals as to how they could make their facility remain viable and sustainable. And recently, I took Shadow Minister for Health Senator Anne Ruston to Maryborough, where we toured Havilah Hostel and met with the board. I've been in contact with Federal Minister for Aged Care, Annika Wells, regarding Mallee aged care facilities and would welcome her to visit them with me to see firsthand the reality of their situations. So far, the government has blatantly ignored concerns from both the Coalition and the communities that their expedited timeframe could force aged care homes to close because they just cannot access staff. This will either see residents sent to overburdened hospitals or older Australians from rural and regional Australia forced to travel away from their local town to find a residential facility elsewhere, separating them from their families in the final years of their life. This is simply un-Australian. We want and expect our older Australians to be well supported and cared for in their own community. That is why, in government, the Coalition called the Royal Commission into aged care quality and safety to ensure our oldest and most vulnerable Australians receive care that supports and respects their dignity and recognises the important contribution they have made to society. The final report of the Royal Commission made 148 recommendations, the product of compassionate scrutiny of Australia's aged care system. In response, the Coalition committed $19.1 billion to a 5-year plan to improve aged care with new home care packages, respite services, training places, retention bonuses and infrastructure upgrades. we listened to the experiences of Australians who gave evidence to the Royal Commission, and I thank each and every one of them.